Hello everyone and welcome to your introduction to the drug tariff lecture. My name is Pooja Kashyap and I'm a community pharmacist, and I'll be walking you through the basics of the drug tariff today. The aim of today is to understand the main functions of the drug tariff. So hopefully by the end of this lecture you should be able to briefly describe the drug tariff and its main parts and how it's designed to work for NHS prescriptions. Discuss charges and fees and disallowed items, also known as the blacklist, and understand how pharmacies endorse prescriptions. So usually the drug tariff is sent to the pharmacy every month as a paper copy, but because it is continuously being updated with lots of changes, it's usually easier to access the drug tariff online through the website linked. So you can access the most current form of the drug tariff at any point if you have the internet, or as I mentioned, some pharmacies will still be receiving the paper copies. So when you're going to your placement, just ask to see if you could flick through the hard copy of the drug tariff. So what is the drug tariff? So you'll need to access the drug tariff online for your PAM sessions in order to be able to endorse your prescriptions appropriately. So as mentioned before, it's available as a paper or an online copy and sent to every pharmacy. So it's published by the NHS BSA, but also can be given to GP surgeries who request them. So you have one edition for England and Wales and another for Scotland. And basically it is a list of prices and a book of rates. So it will be a list of prices of drugs and fees for pharmacies. So it would give you the prices of drugs to be reimbursed and any fees that the pharmacy is able to claim for. Okay, so it contains details of the NHS community pharmacy contractual framework. So this is the basics of what a pharmacy is able to do and again claim fees for. So the drug tariff can be quite difficult to navigate through. So it has 20 sections, all given Roman numerals. So you will have to familiarise yourself with Roman numerals, as people will refer to it as section 8 and you'll be reading it as section VIII. Okay, so do become familiar with what those Roman numerals stand for. So not all sections are used by all community pharmacies, so some things will be applicable to your practice and others won't. So we will go through this in more depth in future workshops. So as I said before, it is updated monthly because imagine there are always new drugs or discontinued products, different categories and services, and definitely new prices of drugs depending on ingredient costs, manufacturing, all of that sort of thing. So the prices need to be kept up to date. Also, you'll find the rules for payment of fees as these may change. So always be vigilant of any major changes of the drug tariff and they will notify you of any big changes. Okay, so the PSNC will publish price concessions. So if there are any major changes, the PSNC will give you the main changes in a digestible format. Okay, so what is not included in the drug tariff is any clinical information or any clinical guidance. So nothing on what should be given to a patient for any preference reasons. Will just give you the basic price of if given. This will be how much the NHS is able to refund you back. So you may be using the drug tariff only for PAMs at the moment to endorse prescriptions, but community pharmacies use the drug tariff for a range of reasons to check many different items. So as mentioned before, the prices of drugs and the fees to be paid for the pharmacy, but also the charges to patients. So some of you may have noticed when working in community, some patients get charged one item fee, others get charged 2 item fees, and that's all dependent on the type of product that they have been given. More importantly, we're looking at the items that are and that aren't allowed on the NHS. Okay, so here you'd find the blacklisted items, which are items that have not been deemed clinically suitable to be prescribed on an NHS prescription, but also the items that are allowed and which are allowed under specific circumstances, for example, under the SLS scheme. So the payment for essential services, this can all be found in the drug tariff as well, so looking at your pharmacy contract, but also anything for advanced services like your new medicine service, any kind of flu NHS vaccinations you've been doing, any CPCS referrals from 111. So all of those can be found, and the payment and fees associated with these advanced services all in the drug tariff under Part 6. So let's look at the drug tariff in context to an NHS prescription. So your NHS prescription is the prescriber's order form for a medicine, food or appliance or reagent for a specific patient. So we need to be able to figure out what is allowed on an NHS prescription and who can order it. So all of this information can be found in the drug tariff of allowed NHS items and appropriate prescribers who are able to prescribe that medication on a prescription. So the prescription also acts as an invoice for payment. So once you have processed the prescription within your pharmacy, endorsed it correctly, that same prescription is then sent to the NHS BSA as an invoice almost to show what you have given, how much you have given, and to whom, to then figure out how much you should be reimbursed for the drugs that have been given out. Okay, so the prescription works as an order form for the prescriber, but also an invoice for payment for the pharmacy. So we spoke about specific prescribers being allowed to prescribe specific drugs on the NHS. So in order to be able to make this a slightly easier process, some of the forms have been split up. So you'll see an FP10SS, a green FP10 form, being used by GPs, independent prescribers, hospital doctors as well. And you'll see the FP10Ds being used by dentists. So those are the yellow prescriptions. And then you've got purple prescriptions used by community nurse or even independent nurse prescribers. So those are your lilac scripts that are used, and then you've got the FP10 MDAs. So they're usually used by specific drug misuse clinics. Okay, so they can be GPs, independent or supplementary prescribers, but usually that is for a substance or a drug misuse patient specifically. So I have included in here the FP10DTs, so they're the dispensing tokens used as an electronic prescription copy. Okay, so those are the things that are printed within the pharmacy, used for electronic prescriptions. And FP10 PCDs shouldn't be confused as an NHS prescription. They are a private prescription, but on a pink prescription format for auditing processes. They are not an NHS prescription and won't be reimbursed by the NHS. They are a private prescription for controlled drugs, solely for auditing purposes, are sent to the NHS. So here we have different prescriptions in the UK. So first you'll be able to see the main sorts of differences. So we've got a normal FP10 in the middle, which you'll probably be most used to seeing, the endorsement column on the left hand side, and then we've got some Scottish and some Welsh versions of an FP10 prescription. So here you'll see that the endorsement column is on the right hand side, but also you'll see the backs of prescriptions. So often they're not paid for. Their prescriptions are free, so you'll see that the back of the prescription isn't the same as what you would find in England, as we do charge patients for prescriptions. But also you'll find that the actual prescription form is slightly different. So with the Scottish, it's a different colour. You'll see that the Welsh version is embossed with a different pattern in order to just have some differentiation between the forms. Part 17 of the drug tariff shows us the prescriber formularies, so similar to what you can find in the back of the B&F. So Part 17A is the dental prescribing formulary, so this is usually what dentists can prescribe on an FP10D yellow prescription. So you'll notice that it's lots of items that are acceptable for their practice or suitable for their practice, but not all strengths and formulations are allowed. So for example, they are allowed some doses of acyclovir, but not allowed acyclovir 400. And often you'll only see the generic drugs shown and not the brands unless they are clinically viable. You also have the nurse prescribing formulary, which has many P and GSL meds included, with some quantities limited, especially for painkillers. And also, interestingly, you'll see that all appliances that are listed in Part 9, so usually a lot of dressings, are all allowed for nurses to prescribe. And they haven't listed all of these. They would expect you to check the drug tariff and make sure that the dressings are listed within there. Part 17B will stipulate what independent prescribers can prescribe. So for pharmacists and nurse, usually all licensed medications including CDs, and for optometrists, only items that are used for the treatment for the eye or the surrounding area. Similarly for physiotherapists, chiropodists and paramedics, it would usually be items that are used within their practice and must prescribe within their own competence as well. So do have a look through these and exactly what the prescribers are allowed to give out. Also here, to get a bit more of a clearer understanding, it might be worth looking at the PSNC website. As mentioned before, the PSNC are very good at making the drug tariff a more user-friendly, digestible format of reading the information. Okay, so that was the PSNC website, and then you can have a look at the independent prescribers and exactly what they can give out. So this is an extract from the PSNC website. So here we're looking at supplementary prescribers, and it shows that supplementary prescribers can only prescribe within their competence and as agreed by the patient and the doctor or dentist as part of a patient's clinical management plan. So as long as they are prescribing within their competence and for an agreed ailment, usually that this is fine. And whilst you're working in community, you'll get to know your supplementary prescribers and the GP practices that they work at, so you may even become familiar with their area of competence as well. So it's not something that you'd need to worry about too much, because usually they're quite accessible. Even they'll come in and introduce themselves to you, especially if you have a close working relationship with your GP surgery. So here I have a question regarding a dental prescription and a nurse prescription. So what I would like you to do is have a look in the drug tariff. So online, follow the link, open up the most current drug tariff, and have a look to see if these prescribers are allowed to prescribe these medicines on these appropriate forms. And then you can come back to the second part of the screencast and we'll go through the answer.